There are many forms of courage, and today on the Mental Space podcast, I'm delighted to be talking to one individual who I think defines one of those types of courage. My guest today, Adel AlFalasi, entered the Mentl Awards 2023 and actually won in the Overcoming Barriers. Now imagine growing up with mental health illness, and yet your community looked at you as the possessed boy. This individual has inspired me, and I am so grateful to be able to share his story with you today. Adel AlFalasi.
Yes, sir.
Welcome to the Mental Space podcast.
Thank you for having me, man.
First question,
Yes.
How are you today?
Well, I'm very humble and grateful. I cannot dreamed ever in my life to be in this situation that I'm being here with you today. Yeah, seriously.
We'll come back to today and
Yeah.
what's happening, in your world right now. In as much detail as you want to go into, just give our audience an idea of the challenges that you faced growing up with a mental health illness.
Yeah. Where do I start? Well, I never knew that I had a mental health issue with my own, like growing up, being as a 10 years old, or even in my adulthood.
Yeah.
And I cannot really recall when I realized that I can hear my similar to my own voice outside of my head.
Yeah.
So I got used to it, and I start giving them a religious name to differ each voices from another.
Yeah.
So growing up with my family not aware of, or they don't have an awareness or an education. The correct education around the mental health. Definitely something out of ordinary. They will look at he's acting abnormal. So could be supernatural, or this could be a magic, or this is like a black magic, something like this. So or possessed.
Yeah.
So I struggled with that since I was 10, 11, and then 13.
I know. I think you told us when you entered the awards that you used to believe that you could see ghosts, such was your condition.
Yeah, well, I did not even refer them to as a ghost. I was just running to my father, telling him that I see like an older woman, like close to that she looks like my grandma.
Right.
And he's like, okay, he will call out my mom. He's like, okay, do some sage, like, or bukhur. We say bukhur, which is Luban or Omani Luban in our culture. So we'll do that around, and then we'll just try to make me feel safe, and he'll just go pray and read Quran, obviously, because we are Muslims.
Of course.
So, yeah, they would just brush it under the rug just like that. So
tell me how did things change for you? Because I know you eventually came under the care of a very inspirational doctor that we'll talk a little bit more about.
Yeah.
But at what age did you enter the system of treatment, and how did that begin to work for you?
I entered the treatment when I had a stroke in 2020.
Okay.
And I was driving. I was just few seconds away from the main gate of the house, and I crawled down from the car, and my mom ended up seeing me there, and she started obviously reciting Quran over my head because she doesn't know what's going on with me.
Mm-hmm.
She doesn't know how stroke look like.
Yeah.
So for her, I'm having those one weird moment of being possessed now. So from there, I had a full checkup in Sulaiman Al Habib Hospital, and the result left the doctors there a little bit more curious, like why I had a stroke at this age.
At 20, how old were you?
I was 30.
30.
Yeah, 30.
Yeah.
So they were a little bit more curious. They said, all right, so they handed me my reports, and they gave me all the x-rays and the CDs. They just told me, go Adel and check with the psychiatrist. I was like, I've never heard that word before. What is psychiatrist? He said, basically go to ML hospital and check with them. Or if you can go here, go. But I'm not sure if the insurance will cover it for you. For me, at that moment, I was not listening to anything that the doctor was saying. When I heard ML hospital, I'm like, no way, I'm not going to a crazy people hospital. The stigma right there, even though I'm going something so difficult, not knowing that, no, I have to go and check there. I'm not being, so because of the stigma that overcome me, I'm not going to go there.
Yeah.
Plus, because of my voices, so I had to start having conversation and saying, okay, if I go there, they will know, the people already following me, and whoever reads my mind will know that I went there, and they will start exposing me. So I'm like, no, okay, I'm not going to go there, but I will find a different hospital just to know, because I am a curious person as well, that why I had this stroke.
Yeah.
Maybe these doctors not professional enough to know.
Okay.
So I was doubting it like that too. So when I went to the clinic, private clinic, they're amazing people there. There initially, or they gave me the diagnosis of possible schizoaffective disorder. But then I struggled all the way with several encounter with different psychiatrists and psychologists, from private to ML. I ended up being an ML, and then I finally met my hero, Dr. Nahida.
So Amal, I mean, you had that stigma around, you say crazy people hospital. Obviously, everyone in there was struggling with, a mental health challenge, mental illnesses. Was it, in the end, are you glad that you ended up there? With that, because that was part of your pathway to meeting Dr. Nahida.
I'm glad I ended up there, even if though wasn't really supportive enough. But I knew there's something that it shouldn't be like that as well. So I knew the lack of certain practices.
Yeah.
And I've noticed different things there as well. So that kept me away, or not kept me away, sorry. I meant that kept me searching more into the medication and how I will be living better.
Yeah.
Because I always had, when I isolated, or when I faced darkness and it threw me into isolation, and I started knowing that I'm doing certain behaviors within my own home with my family, I always had this idea of I have to protect people who's around me from myself. I have to do this. So at that time, this idea even just became more bigger now.
Okay.
So I start thinking about the community. I start thinking about people at work. I need to protect them from me.
How did you end up with Dr. Nahida? And for those who don't know, Dr. Nahida Nayaz Ahmed, inspirational lady.
Yeah, definitely.
She's now, I think, Chief Medical Officer with CIHA. She was one of the judges for the Mental Health Awards as well, our Mental Awards, and a tireless campaigner for mental health here in the UAE.
Yeah.
How did you come under her care, and how did that change the path of your life?
I didn't know her.
Yeah.
So because of what I've went through at my work, they did an evaluation for me.
Yeah.
So I was like, all right, I'm still struggling. The symptoms are they're not getting less, or they're not reducing.
Yeah.
So I want to be in a better place like I used to be when I was growing up, in my childhood or my adulthood, or being a teenager. Wasn't like this very hard now.
Yeah.
So I just went on the website for Sahha, and I took an appointment there. I just started finding one appointment. I was like, okay, now they have my reports from ML Hospital, and Abu Dhabi is a government system, so why just give it the last shot and see? I'll follow that last chance, or the last light to be there and see who can know what's wrong with me. And to my surprise, or to my luckiest day ever, I met her there. I just went there. I didn't know her. I sat with her. and she started asking me questions that not all psychiatrists does, actually.
Okay.
I was confused. I asked her even, are you a psychiatrist or are you a psychologist? She said, why? Because I told her, I've been through a lot with psychiatrists, to the point where every psychiatrist keep switching, just they're throwing me to another because they don't know what's wrong with me exactly. So she said, no, I am a psychiatrist, but don't worry, we'll be in the right path.
Perfect.
Yeah.
And so tell me about the treatment and how you've then progressed from where you were under Dr. Nahida. What have you done to turn your life around and get on that better path?
It's just the two questions that she raised on one of my refill when I went there. We're having conversation. She wants to know how I'm doing at work and in my daily routine life. And she just asked me, for people who are having similar to your condition, they tend to be creative. Are you creative? Do you have something? Are you doing something? It's just that question. I told her, I think I do. I have few sketches, few drawings here and there, but when I get back home, I'll show it to you. Is that okay? She said, okay, you can bring it next time, or so. I'm like, all right, I'll do that. So I showed her that, and that sparked another thing, or she knew how to talk to me in a way that, like, there is other people out there. They need to know or see your art, or probably it's gonna be like relevant to them. They can relate to it, So
art.
So art. Yeah, art was the way.
What was it about art? Like, what does it do for you when you're creating?
I'm still figuring that out, like how it's therapeutic.
It's medicinal. We're not quite sure.
Yeah, it is therapeutic for me, but I'm still trying to understand how is my hand trying to create something that it was there in me before, but it wasn't this much to the point where I'm doing it now.
Except now you've got to the point where you've exhibited at I think it was the 3rd Integrated Mental Health Conference.
Yeah, definitely, yeah.
You've had that exhibition.
Yeah, that support,
yeah.
I think that support as well, it sparks something, like it makes you more enthusiasm about your own skill, I would say, or your own gifted hobby, or whatever you want to call it.
And having had that reception, of your artwork last year, what did that give you?
The award.
Just apart from that, like with people coming up and looking at your artwork, and telling you, giving you their feedback of what they liked about, how did being public in that way help you or affect you? It
just switched the way I was looking at my own, your own writing or your own drawing. So for me, it was art. I was like, people will probably criticize it, or people will be like, look at this. What is this? This is not something good. You cannot share something like that. So I was always hesitant about showing to others, because I went through that before and people laughed at it. So I was like, no, so nobody gonna care about it. Or maybe even if people will a little bit look into it from a curious perspective, they will not understand it even if you explain it to it. But that conference over there changed the whole thing that was the way I was thinking of, because there is smart people out there, and they start pointing at my own art and explaining every single thing that I did in the art.
Wow.
Because the way I draw, I try to do it from a different angles, so many. So I will let it for them to explain it how they see it.
Yeah.
And every person, they say, you did it this way, or you draw this because you want it to be like this, right? I'm like, that's correct. So I'm easily to be read then.
And what would you say is the difference then between Adel today and, say, Adel of 5 years ago?
5 years ago? 5 years ago, I was So it was 2020,
2019,
2018. Yeah, I was just getting out of national service. I think I was at very low stage, and the only hope or rope was for me is to hold on into again. It was my religion.
Yeah.
It was Quran.
Yeah.
And the first thing that I did, I went to Mecca, to Saudi Arabia.
Okay.
When I got my first job and where I am at today.
Yeah.
So that's the first thing that I did, and from there I was still struggling with my mental health.
Yeah.
So I was a very low stage. From then until today, it's just dramatically changed. It's like yeah, you cannot compare Earth to the sky. So I think I'm on the sky right now.
You're on the sky right now.
Yeah.
So we'll come on to perhaps some of the stuff we discussed with the awards, but your experience today, you've talked about stigma.
Yeah.
You have started talking openly, and you won one of our awards, the biggest award of the night.
Yes.
To overcome barriers. Dr. Nahida presented you with that award on stage in front of a room, 200 people.
Yes.
At in the St. Regis prestigious event. What has that done in terms of inspiring people around you, inspiring your community? What's the reaction been to you being vulnerable, being brave, being courageous, and actually doing again what we're doing again today, which is talking about this and tackling the stigma?
Yes. People that I did not expect to see them happy for me, they were really happy, and they were very supportive, and they were amazed, and some of them were shocked that I went through all that. And there are now so many people at work that, because I shared that news as well at work, and in my work they publish it in the news at work on a daily, on weekly news, and people start messaging me at work telling me this is so brave of you, how can we support you? And they were some mental health aider as well at work. So they said we have a certificate, so how we can do something beneficial, or how we can spread more awareness at work, please guide us. I'm like, it's like they look at me as a leader now. I'm not yet, wait. So that's one thing at work. For the community, people's around me, for like friends and families, they've been supportive as well. They're happy, they congratulated me, and they just now, I think some of them, they're curious, they want to know exactly the details that I shared with the doctors and not with them. Yeah, even though I was living with them and it's been very obvious, but they don't know how it's from my perspective.
If somebody's out there struggling, what would your message be to them, having gone through your experience? You were initially fearful of entering treatment.
Yes.
And every treatment path is going to be different. Some can be a bit hit and miss, or it can be, you can get it right first time. But you entered the treatment path. You were fearful of that, and yet that's changed your life. So if somebody is struggling out there and they feel, the stigma is holding them back from talking, what would your message to them be?
I would say, if you don't have people around you that they are supporting you in a way that is making you happy or safe or feel comfortable, do not hesitate to seek help further than that, outside that circle or outside that box, because there is out there people who will understand you the way you want to understand yourself as well. The moment you reach to the right person there, or that right person shows up, you will be in the right path. You will be in the right path. You will receive the right support that you need or you deserve as well.
Talk me through what the evening of the Mental Awards was like for you, because it must have all been kind of overwhelming in some ways.
It is overwhelming. It is very overwhelming. I was scared to be alone there, so I was trying to call the Dr. Naida. I told her, "Are you going to be there?" She's like, "Yes, I will be there." And I asked as well my very, very supportive friend. I don't look at her friend. I look at her as a sister as well. She's I asked her to attend with me there. So she said, "Yeah, definitely I will come into this for this event to be with you there." And she showed up there as well. And I was like, I'm just very glad to be here, just to be nominated, at least to be among these people that we've been recognized as what's going on in our life. We have the chance, or it is a platform now, or it is a way of sharing this. This thing exists in our community, and people need to take it seriously.
Yeah,
it's not something that is.
Well, often, we all think that we're the only one going through something, and we're all kind of desperately need to be seen and to be heard. You were definitely seen and heard on the evening of the awards.
Yes.
What was your reaction when we announced you as the winner?
Yeah, I was shocked, and it was at the very last thing that I was like, I was surprised, and I did not know how to act. And I don't think if you saw me, I was like walking and stopped and then go back again, because I felt something is pulling me. Like, no, it's not you. But yeah, I was very, very, very grateful, and I will be forever grateful that evening, that night. I don't know, it's still a dream, or it's just like a deja vu at the same time.
Must have been special to have Dr. Nahida there present that award to you as well, someone who's done so much for you.
Perfect.
Yeah.
Perfect. I couldn't ask to for anyone else to be there, because I see her the prime role model example for me.
So what's next for you? Where you're in this great space right now.
Yeah.
You're doing well. Also, you have a platform now to talk about, to talk, to be seen, to be heard. What's next for you?
Next, hopefully we'll attend the 4th Abu Dhabi Mental Health Integration Conference. We'll be there. And I'm writing a book, actually.
Oh, wow.
Yeah, I'm writing a book. And I've been writing it.
Can you give me any spoilers, or can you?
Yeah,
give
definitely. I'll just give you. I'll give you okay. When you first meet people, you'll ask them how you doing, or just to catch up, to understand their behavior, or the way they think about certain things, if you guys gonna match and thoughts or not. Just having a conversation. But once you know some of your friends and you haven't met them for a long time, you'll ask them, "What's your story? Where you've been?" So I just took those two and combined them and made them as, "What's your secret?" for every single individual living on this earth.
Wow.
Yes.
That's a big mission.
Yeah.
And you started writing that book?
Yeah, I've been writing it now since 2 years.
For 2 years?
Yeah, 2 years, but not every single day.
No. Well, when are we going to see Adel at the Emirates Literature Festival then? When do we think we're going to get this published?
Inshallah, if God's will, this year.
This year?
Yeah, this year.
That sounds super exciting.
Yeah, this year.
Where do you think we're at, with the mental health conversation within the UAE, but also kind of globally, from what you see now that you've seen that people are talking about this? I mean, it's fascinating. Very recently, I was on the radio talking about the new mental health law that's been passed by the UAE, which was amazing. And actually, it's kind of like that just for me establishes in law that the treatment path that you went on actually works, and it can be successful. So that for me was a step forward as far as the UAE was concerned. What do you see as the climate right now for the mental health conversation here, regionally, globally?
As of my country, I see it. This is a very big step that the law just came out recently, or they
Yeah.
released it, and this is a step that everybody needs to consider it in every sector, in every corner, in every way that they are, in whatever field that they are working or functioning in. They
Yeah.
need to take care,
Yeah.
or they need to have that in back of their mind. The mental health.
Well, it was kind of amazing, wasn't it? Because it almost gave equal weighting to
Yeah.
mental health as well as physical health,
Yeah.
which is a first. But also, it told employers
Yeah.
that they cannot,
Fired them.
cannot discriminate against
Yeah.
against an
Yeah.
employee who has struggled with mental health. And
Yes.
we're seeing this all the time.
Yeah.
So, from your point of view, a huge step forward.
Yeah, huge step forward. Yeah, huge step forward. That they are taking this and consider it more than it used to be. They used to, this thing was there,
Yeah.
but it wasn't to the point where today more people start talking about it. More people start sharing their stories, and they
Yeah.
want people to understand different diagnoses or different struggles or challenges.
I mean, part of the mission of this podcast is to normalize the conversation.
Yes.
And to actually let us all know that there shouldn't be anything scary about, us sharing. If you broke your leg, you would happily share with your friends, family, community
Yeah.
that you'd broken your leg.
Yes.
Mental health has the same weighting as
Definitely.
Yeah.
Mental health, if we will, once that norms comes into a place, how many lives we're gonna save from preventing them to go to the limit where they
Yeah.
start thinking about suicide.
absolutely. Which, if we look around the world,
Exactly.
and we don't have to be specific about geographies. If we look around the world, suicide now is one of the leading killers, particularly of men as well. because
Yes.
there's other challenges for us to open up to other men and to our
Exactly.
community around us to talk about
Exactly.
mental health.
Yes. So we have to establish a safe place, a safe space for people to talk or to share, or to share their challenges and burdens, to reduce the thoughts of going to that path.
Yeah.
We won't be able to do that if we keep just feeling shame or shy away, or that's not gonna work, or that's not gonna prevent them from not thinking of that.
I understand you're going to be making a speech at the conference.
Yes.
Give me a 10-second preview of, or what are the themes of the speech that you're going to make?
I'll be talking as a mental health advocate over
Yeah.
there, and I will share I will share a little bit, a shortcut or a short story of my journey and this mental health challenges that I've faced, and I will be talking to the decision makers.
Oh wow,
Yes,
that's got to be. Can you actually believe that you're having these conversations now?
No, not in my seventh dreams. No, never.
But
ever.
isn't it amazing as well that we're both excited about the fact of having these conversations?
Yes,
about mental health?
definitely.
5 years ago, I'm not entirely sure the world was ready for as many open conversations about mental health.
Yes.
Um,
Now I think the world gonna hear about Arabs' mental health and
Well,
their challenges as well.
absolutely.
Yeah, we would love to change that stigma about it's mental health doesn't exist in this region. No, it does exist.
Well, we can see from the statistics. I mean, I think the UAE universities got together, and I think from 2019,
Yes.
their statistics was that 1 in 3 people
Yes.
were impacted by mental health, which is very close to the World Health Organization, which is 1 in 4.
Yes.
So if we say it's 1 in 3, and we look in the room that we're sat in right now, which is 4 of us in here,
Yes. Yeah.
and actually, I think the irony is that at least 2 of us, probably 3 of us, have all been impacted by mental health.
Definitely.
So when we
yeah.
say 1 in 3, let's
Definitely.
face it, the reality is almost everybody struggles.
Everybody, yep. But the difference is that some people talk about it
Yeah.
and some people don't. They just accumulate it. They just keep it inside, and then that temporarily bomb will explode at some point.
What have been for you the 3 things that have helped you the most? Then, if we were to give the audience listening 3 of your experiences, just if you can distill down into 3 pieces of very simple advice.
Very simple advice through what I went is For myself or for others? For others?
Either.
Anybody?
Either.
All right. I'll just do it in a three-way. For others, listening is crucial.
Yeah.
And listening without attaching to whatever you're listening to, your own beliefs or to your own references, is even more critical. You have to understand the person who's sharing his challenges with you, what is exactly he's saying.
Can you listen without judgment?
Yeah, can you listen without judgment? There you go. Yeah. So listening skills is different than communication skills.
Yeah. Yeah.
Yeah, that's for others and for people that, you know, that they need to take it in account when they just having a normal even conversations.
And then for yourself, or for anyone who is struggling, what would you say is the most important piece of advice for them that you've learned?
Losing hope is not the way. Instead, the world is still we are still in a better place, and we can make it even more better. That change of a thought begins with ourselves first.
That's kind of inspiring. I mean, I know people find themselves in dark places, and anyone from outside will tell you that that's temporary. Sometimes it doesn't feel temporary when you're in it.
Yes.
But your message to anybody struggling is don't lose hope.
Yeah, don't lose hope. Yeah.
I think your story shows us all that there is always hope.
Yeah, there is always. And the good, the positive things, even in the things that are not going the way you want them to go.
Yeah.
There is something positive about that in there, but you just don't know about it yet.
Adel AlFalasi, it's a genuine privilege to have you on the podcast today.
Privilege all mine, sir.
Honestly, you humble me every time we talk.
Thank you so much.
Thank you very much for being on the Mental Space.
Thank you for
podcast
having me
today.
Thank you, sir.
Please, if you have been affected, impacted, if Adel's words have resonated with you today, please take one thing away from this, which is you're not alone, and that you should reach out, and you can reach out. And I think Adel's story is proof of that. If you have engaged with this conversation as powerfully as I have today, remember that you can subscribe to the Mental Space podcast. If you're watching us on YouTube, please hit subscribe, or that you can find us on all of the good podcast channels, Apple Podcasts, Spotify, or Google Podcasts. One last time, Adel, thank you for joining us.
Thank you for having me. I'm very grateful. I will be forever grateful.
You're an inspiration.
Thank you, sir. Thank you.